So Idaho just hit another pretty big COVID milestone. According to the latest numbers just released by the state, we have now surpassed the 200,000 case mark. The state recorded 529 new and probable cases today. It's the biggest one-day total since March. We're also now at a statewide positivity rate of 8%, which is up from 5.3% last week. It's also the highest that we've been since January. And the number of confirmed Delta variant cases, that's doubled in the last week. We now sit at 70 total cases. Finally, 2 new deaths were reported today, bringing the total number to 2,197 since coronavirus came to Idaho. Which is why health experts are ringing the warning bell once again and changing the pandemic protocols, like reversing their earlier decision to let vaccinated people go without masks, an edict some say was premature at the time. Now it is recommended even fully vaccinated people wear masks indoors, and all schools should include them in their back-to-school lists. Like many areas across the rest of the country, Idaho is also seeing rising case counts, as well as hospitalizations and ICU visits. Idaho, not immune to this Delta variant surge. And those same health experts will tell you that vaccines are the best way out of the situation in which we find ourselves. Joe Paris brings us the big picture and the small picture perspective from the highest level, the White House vaccinations coordinator.
Well, we are concerned about the rapid rise of the Delta variants across the country. We know this virus is much more contagious.
White House vaccinations coordinator Dr. Bashara Shukair explains just how quickly the Delta variant has spread across America in recent months.
We know that 2 months ago, only 1% of the infections were caused by the Delta variant. Today, more than 80% of the infections are caused by the Delta variant. And in some communities, it's almost all infections are caused by the Delta variant.
The state of Idaho now reports 70 confirmed cases of Delta variant. Just 9 days ago, that number sat at about 35. State officials have admitted in recent weeks that they were behind in testing for the Delta variant for a variety of reasons and believe the actual amount of Delta cases to be much higher. Dr. Shukair echoes the seriousness of the situation, but says there's a great option to help the situation.
Now, the good news about the Delta variant is that we know vaccines work. They're very effective at preventing infections, and they're particularly effective at preventing hospitalizations and death.
New insight from the CDC shows that vaccines are still highly effective against the Delta variant. The Pfizer vaccine, for example, is believed to be up to 88% effective in preventing symptomatic disease from the variant. Still, the Delta variant is highly contagious, and it is now believed to be even transmissible from fully vaccinated people who are breakthrough cases.
Now, what we're also learning is once you have a breakthrough infection, then your viral load is high, and that's the concern and the reason behind the CDC updating their guidance that if you're vaccinated in communities where you have a high or substantial level of infection, it is important that you wear a mask.
Idaho reports having a total of 818 vaccine breakthrough cases since the vaccine became available. Late last month, the number of statewide breakthrough cases was 445, meaning 373 new cases were identified since. While the numbers are important to note, Dr. Shukair says that the health outcome for those cases are likely good.
Now, what we're learning about these infections, these breakthrough infections, the overwhelming majority of those are either mild symptoms or no symptoms whatsoever. So while we could see some breakthrough infections, I want to be very clear that the vaccines are very, very effective.
Idaho remains below the national average in major vaccine metrics. 45.8% of the eligible population, those 12 and older, are fully vaccinated in the state. The same statistic on a nationwide scale is about 58%. County-wise, Idaho has a range of vaccine percentages from low of 28% in Idaho County to a high of 86% in Blaine County. Now, the White House is shifting their focus on addressing the low percentage vaccine areas.
If you have a community with low vaccination rates and you have a rapid rise of a virus that's much more contagious, you have a recipe for a spike. There's no question about it. So it's really important that we continue to double down on our efforts. And let me just also be very clear. We're already seeing an uptick in the number of people who are getting vaccinated. And just this past week alone, we've seen a 30% increase.
Okay, so that 30% increase, we were looking at the state's website just before we came out here. We actually saw a decrease in the last week or so, right, when it comes to vaccinations.
Yeah, so that 30% number, that is countrywide. So the point he was trying to make is that we are seeing people that are responding to this new Delta variant, Brian, by saying, okay, the time is now for me to go in and go get the vaccine. Here in the state of Idaho, according to the numbers we saw from the Department of Health and Welfare, we did see an increase last week, but now into this week, it is slightly down. So it's a question of, did they overachieve last week, and now that we're seeing less people get it this week, is it a big deal? The bottom line from health experts is that no matter what, it is better. Each person that gets a vaccine, it's better and better. Okay,
so President Biden said he would like to see states give out an incentive in the form of money when it comes to these vaccines and getting people vaccinated. We have a surplus in this state that has, a lot of it comes from the CARES Act money. We have a surplus in that. Could we see some monetary incentives here in Idaho?
Long story short, it doesn't look like we're going to see that from the governor, Brian, but I did hear from his office, and they are asking people to get the vaccine and really highly recommending, if you're eligible and you can get the vaccine, go out and get it.
Just do the right thing is basically what Governor Little's saying. All right.
Yeah.
Thank you very much, Joe. All right, so we urge people to get the vaccine. At least that's what the governor does, because that's the right thing to do. This morning, an internal document from the Centers for Disease Control was shared outside of the office. Kind of what we were talking about a little bit ago. A PowerPoint presentation depicts the struggle that the health agency is having getting people to get vaccinated or apply other preventative measures to help stop the spread of the coronavirus, and specifically this Delta variant. They said the war has changed, and probably the biggest revelation, that even vaccinated people can spread this disease. The reason behind this whole get the mask back on thing. The Delta variant has a high viral load. The experts call it about 1,000 times higher than earlier strains, meaning it can sneak past the vaccine sometimes. In that report, the CDC said the Delta variant appears to cause more severe illness in those unvaccinated, and it spreads as easily as chickenpox. So what does that mean? Well, we reached out to Idaho's Department of Health and Welfare for an explanation, and it's all based on this R0 factor that we first heard about at the beginning of the pandemic. In the beginning, that R0, which is that scientific formula that determines how easily a virus spreads, how many people one infected person could infect on average. In the beginning of the pandemic, SARS-CoV-2, what we now know as coronavirus, was estimated with an R0 factor of around 2.5. That meant every person who got the infection would infect about 2 to 3 people on average. For some historical perspective, the seasonal flu has an R0 of 1.3. The swine flu that sprang up in 2009, the H1N1, about 1.5. The 1918 flu pandemic, the last pandemic on this scale that we like to use for comparison, the R0 of that was about 1.8 thereabouts. Chickenpox has an R0 of around 8, and the Delta variant has a spread rate on average between 5 and 9 people.